Good afternoon, everybody. My name is Retsef Levi. I hope you can see my personal title slide labeled as Slide A on the bottom right. I'm on the faculty of the MIT Sloan School of Management. I have no conflict of interest to disclose today, and my presentation represents only my individual opinions and does not reflect in any way on the positions of MIT. Next to Slide B. Since the Pfizer's request for the approval of the boosters is partially based on the so-called study conducted in Israel, it is important to understand that the booster vaccination campaign in Israel was anything but a carefully designed study. In a matter of less than 6 weeks, Israel moved from its initial intention to vaccinate the over 60 population to vaccinating anyone above the age of 12, and it is now about to mandate booster vaccination for anyone to maintain green passport status. This does not allow any reliable learning, definitely not in such a short amount of time. And please understand that the adverse event surveillance system in Israel is truly dysfunctional, particularly around the booster deployment. I know from personal experience that the Ministry of Health in Israel does not address appropriately major concerning safety signals. Next to Slide C. This leaves us with the question, what drove this massive booster deployment? Next to Slide D. Trying to reach vaccine-induced herd immunity by reducing transmission rates will be consistent with the stated goal of the agreement that Israel signed with Pfizer, as you can see on Slide D on the left-hand side. The problem is that by now we already know from mounting evidence that reaching herd immunity based on the current vaccines does not seem like a feasible or realistic goal. Not surprisingly, as you can see on the right-hand side of Slide D, Israel continues to have among the highest infection rates per capita in the world. Next to Slide E. You all listened to a presentation of the Israeli Ministry of Health that praises the efficacy of the boosters. I would like to caution this premature celebration and remind you that similar statements were made just 6 months ago around February on the 2 initial doses. Note on Slide E on the right-hand side that COVID-19 deaths in Israel, in spite of all of the boosters, are on the rise, whereas in other countries, including many states in the US, they seem to be on downward trend at the moment. The data from Israel also highlights that the main risk of serious COVID-19 outcomes is focused to a large extent among the completely unvaccinated population, and almost entirely in the over 61. On the left-hand side of Slide E, you can also see data from Table 1 in a research paper by the Ministry of Health in Israel that suggests that the benefits from the boosters compared to the prior 2 doses in preventing serious illness might be much more limited than desired. There is much more to say about the problems of the current booster efficacy study. Next to Slide F. But let me conclude by stressing how important it is to transition from emergency strategies to long-term ones. Slide F outlines 5 important considerations in doing so. They are self-explanatory. I hope you will hold off of approving this booster for broad use, at least until such a strategy is developed. Thank you for your attention.